Hey, how are you doing today? My name's Tyler and I'm going to be your nurse for today. So we have a physician's order to administer a nasogastric or NG tube today. So how that works is we're going to be inserting a tube through your nose, down your esophagus, and into your stomach. And what this is going to do is provide basic nutrients, and if we need to provide any medications, we can do that as well. So first things first, I'm going to ask you to repeat your first and last name and your date of birth. So if you'll do that for me real quick. All right, Mr. Tillman, thank you. And do you have any allergies? Any known allergies or any known nasal surgeries? Okay, thank you. And for some reason during this procedure, when I'm entering the tube through your nose and down your esophagus, if for some reason you can't breathe, there's cyanosis, there's inability to talk, or you gasp or cough, I'll pull the tube out immediately. So, first things first, is I'm going to set the bed position to high Fowler's, or 90 degrees. And now I'm going to drape you with a towel just to prevent the spread of infection and in case you have to throw up. Alright, and I'm going to provide a basin in case you have to vomit. And then I'm going to give you a cup of water for later in the procedure. Alright. So, and now I'm going to check your nose for patency. So, if you can take a deep breath and breathe out. Take a deep breath and breathe out. Okay, thank you. And we're going to use your right nostril today. So, first things first is I'm going to measure the NG tube. And how we do that is I'm going to start at the tip of the nose and go behind the ear. I'm going to go all the way down to the xiphoid process. And once I have that marked, I'm going to use a piece of tape just so I know how far to insert the tube. Okay, and once I've marked, I'm going to lubricate the tube 2 to 4 inches. All right, Mr. Tillman, I'm going to tilt your head back, and now I'm going to start to insert the tube. Alright, and once I get the tube all the way to the pharynx, I'm going to double check just for placement. Okay, I see it at the back of the pharynx. So now what I'm going to do, Mr. Tillman, is I'm going to get you to take a couple sips of water, and every time you swallow, I'm going to further advance the tube. And since this is a mannequin, the tube is not going to go all the way down to the marker, so we're just going to pretend like it does. So every time he swallows, I'm going to further advance while he has his head tilted from his chin to his chest. Alright. And once I have the tube all the way down, I'm going to tape it to the bridge of his nose, just to make sure it stays in place. After that, I'm going to take the last piece next to your gown just to make sure you have enough room to move around. All right, Mr. Tillman, you are ready to go, and we're going to send you to X-ray for placement. All right, now that you're back from X-ray, X-ray said the placement was good, so that means we can commence your feeding. And with that, I'm going to pull the guide wire out to start the feeding. All right, now that your feeding is done, Mr. Tillman, we're going to do a couple things. So first things first is before I take the tube out, I'm going to get you to hold your breath. And before that, I'm going to untape your nasogastric tube from your gown and from the bridge of your nose. Alright, now this is where I'm going to ask you to hold your breath for me, and when you hold your breath, I'm going to slightly pull the tube out. So 1, 2, 3, hold your breath. Alright, there we go. Alright, Mr. Tillman, thank you so much, and we'll be back to check on you.